So today we're going to talk about something that affects about 1 in 10 Americans. And it's not a very popular topic, which is one of the reasons we should probably discuss it. And it's also been requested on my feed, and that is irritable bowel syndrome. And what is irritable bowel syndrome? It's a common functional disorder of the GI motility tract that's not associated with any anatomical changes and sometimes referred to as gut hypersensitivity. And it can be brought on by psychological stress, by pre-diverticular disease or changes in the bowel wall, or a low residue diet, or a diet that's high in rich foods or stimulating or irritating foods. Also, alcohol consumption and smoking can irritate this condition, a sedentary lifestyle, and age and hormonal changes can also contribute to its onset. Some of the symptoms you might be experiencing if you have IBS are gas, also abdominal pain, in particular at the left side of your lower quadrant, and it can be tender to palpation or pressing on it. That pain can be either constant or intermittent and is often relieved by passing gas. You can also have altered bowel habits such as diarrhea or constipation, or alternation between the two. Sometimes the foods that we eat or our dietary habits can trigger a flare. And if you have IBS, you probably already know this. Now, I'm going to talk a little bit about diet here, but unless you've actually been diagnosed with IBS or a similar disorder, I don't recommend that you start any new diet without the guidance from a registered dietitian or your physician. Now, a very widely accepted and recommended diet from Australia for IBS is that of the FODMAP diet. That would be avoiding foods that are high in fermentable oligosaccharides, disaccharides, and monosaccharides such as fructose, or the polyols such as sorbitol or mannitol. And you can start this process by eliminating FODMAP foods from your diet and gradually add them back in at one at a time and monitor your symptoms. A food diary and a symptom chart may be helpful tools. Now, there are some prescription drugs that are recommended for IBS that have to be prescribed by a physician, such as the guanylate cyclase inhibitor category. And you can also experiment with different enzyme combinations as recommended by a nutritionist or your physician. Some people do combinations of enzymes and probiotics, probiotics, and fiber. Some people are reactive to fiber, so the key is to really zero in on your own body's response to both diet, medications, and any of these supplements to find out what works best for you. So I'm hoping that the key takeaway today is to befriend our bodies. IBS may be a sign that your body's needs are changing, or that you're under increased stress, or you're having a decreased ability to deal with that stress. Probably the easiest things for us to change are our diet, our activity level, or our stress level. However, I'm really hoping that you enlist the support of your physician, a registered dietitian, a holistic nutritionist, and I'm also here for you anytime you want to reach out, sarah-montague.com, or you can find me on Instagram or Facebook, Sarah Montague RN. Have a great day, and remember, your health is my passion. So some of the symptoms you might be experiencing, Dad, you're in my shot.